We just finished reading your bio. Perfect timing.
Thank you. Can you hear me okay?
I can hear you just fine.
Awesome. I'm so sorry about that.
No worries. Listen, we were 6 minutes late because I couldn't, all of a sudden I was pressing Instagram to go live. It wasn't, just listen. We're here. We're here.
Excellent.
We're here.
All right.
So Crib community, please give our guest a warm welcome like nobody can. Nobody can. Woo! Woo, woo, woo. Thank you guys so much. I know, appreciate your time. I know you're very, very busy. But I really wanted to talk about Project Thrive, but also for folks to get to know you and what drew you to this work, which is the first question for both of you. So what drew you both to this work? What drew you both to this work? All right. Deshawn, you're smiling, so you go first. I feel it like you have something to say right away.
What drew me to this work, honestly?
Uh-oh. It's okay.
Well, what drew me to this work was the impact I knew that it would serve in the community. Caring about what, like, the ideas Carolyn had and where she wanted to go with this and how she wanted to do it. And even the project she did before in the West, it was kind of similar to this. It was just, to me, I think it was just amazing to just be hands-on with the people of my community when they're in such a traumatic time. I just thought, like, like that drew me to it. And also, after reading the bio that you just read on my partner, Carolyn, how could you not be drawn? Like, it was inspiring, honestly. It was an honor.
I love it. I feel the love. That's awesome. And Carolyn, what drew you to this work?
Well, I mean, I love working with Deshawn, but you can tell that. And many others that I've had the opportunity to work with. So my story, my part to this story is that I learned very early on in my training in emergency medicine that the healthcare system had a really, just one of many roles, of many groups' roles in trying to address the epidemic of violence. And as a junior resident, so I had just finished medical school, I had multiple experiences where I was seeing young people being injured by violence and feeling relatively helpless. And as a physician, we sort of go into medicine trying to figure out, how do we actually help a person with their medical condition? And I always saw this as a public health issue. And so early in my career, I actually had I met a really lovely young man in the emergency department and was suturing up his arm after he'd been slashed with in a knifing, and he it was just a really good half hour. It was a complex laceration. We chatted for a while, and I remember feeling a little helpless at the end as I sent him on his way, sort of thinking, I feel like there's more, but I don't know how to have a conversation that would work, or what can we do? And I feel like, this guy is nothing like what I read about in the media growing up as, a wealthy, well, I didn't know I was wealthy, but I was wealthy, right? A wealthy white woman in Toronto. I didn't sort of ever have a really understanding of what was in what people were, who people were that were getting injured. And this guy was just such a great kid. And the really tragic part was that I met him again in our trauma room months later with a gunshot wound and a thoracic injury, which meant that he was paralyzed. And it really obviously impactful for him and his family. And I got to know his mother in those times. I still remember sneaking her in after visiting hours, because she worked so many jobs and she couldn't come see her young son, right? And as I got to know him and his family more, it really sort of lit a fire under me that I need to be part of making sure that healthcare has a solution, or a part of a solution, is part of a bigger community that's trying to address violence as a health condition. So,
You know, you mentioned so many gems that I don't want to be missed. Both of you, actually, Deshawn, talking about the importance of partnership and the importance of sort of mutual respect and
Right.
investment in a community that you're a part of. But also you, Carolyn, sort of having this view on the outside, but also recognizing the importance of of understanding the whole human being that
Oh,
enters
absolutely.
space, right?
Yeah.
And serving from that perspective, which I so much appreciate, and also recognizing, I heard the structural inequities that are contributing to the pervasive nature of violence prevention, violence as a public health issue. So that's just that framework, right? Is so, for you all listening, that framework is so critical, right? To elevating the work, right, and responding in a culturally responsive manner. So thank you for that. So let's get down to it. What is Project Thrive? What is Project Thrive? All right, go ahead. You go first, Dr. Snider. Go first.
Okay. You can call me Carolyn, by the way. Please call me Carolyn. That's funny, Tanya. So really, Project Thrive it was, you know, the same idea I just spoke about, but you know, there's, my expertise really stops at a certain point, and I only have so much expertise. I sort of speak. I think it's really important for me to acknowledge the place of privilege I come from as a white woman, and acknowledge that I don't have the expertise. I have power being a physician. I have power being a leader and physician, and as a researcher, but I don't have a lot of knowledge. And that's where I knew very early in my career I needed to surround myself with people who have expertise and lived experience, or living in communities that have more experience, and that I need to surround myself with some excellent people. And so Project Thrive was one where you and I met, and Annette Bailey met, and David Gomez met, and then we brought in some amazing people like Deshawn and many others. And so together with Deshawn and SJ and some of the other group, we sort of said what might work in our emergency departments. We weren't starting from scratch. There are programs in the States. I went through a very similar process in Winnipeg, where we started a program called EdVIP, and we learned a lot from what has already worked, but we knew we had to find something that would work in Toronto. And that's where it was really exciting to work with someone like Deshawn, who has brilliant ideas, and so maybe Deshawn, you can sort of go from there, and then should we be describing Thrive, or why don't you describe Thrive?
I think, like what you said, is it's like she hit it on the nose. We've been describing Thrive since question number one, when Carolyn said, like, this youth, and instantly there's something missing. She felt that empty void. That to me is Project Thrive. To me, like, that's aspect. Like, I think excellence. She said she's not an expert in certain aspects, but she's an expert in knowing, like, there's something beyond my job that needs to be done. Sometimes, for example, you could do a job, but, like, sometimes you have to go a little step further to make it complete. And I think she's at that, because she noticed, and then she's seen the child again, and she said, you see, it was like a realization, and then she acted on it. So I think that is amazing, and I think that is Project Thrive. We're trying to identify things as soon as we can and work on them so it doesn't happen. We're trying to eliminate that comeback based off of, we that are proven to, that these kids, or whoever it is, adults, they're returning. There's a high return rate. So what can we do? How can we intervene? Try to lead them a different way. So, like, I think it's like a support system we're trying to implement into the hospitals that, like, ensure some of these things are not reoccurring, like this says. And I think that's Project Thrive. I think we're just trying to help the community in the best way we can. We're trying to help them immediately as well at that time, because we figured that it's that time, like right then and there, after this altercation or whatever happens, it's a prime time to get on them early, and stay with them, help them see what we can do to change the outcome, the future.
Right.
Yeah, there's
And
a real. Sorry, go
yeah.
ahead.
Oh, well, so the idea behind Thrive is that when somebody comes into the emergency department or through the trauma part of our emergency department, we know that there's a 20% chance that they'll have an injury
Right,
in the next year in
right.
Canada, and that's actually probably a good average internationally.
US. Yes.
And so
Yeah.
we know that that's a reflective and an important time for them and their family and their siblings and their community. And so what role can we take in
Mm-hmm.
that? And so the design process we went through with Deshawn and SJ and some of the others was that having an individual who comes in to the emergency department and meets the young person and is with them as they're in the hospital, whether they
Mm-hmm.
just
Mm-hmm.
whether they're admitted or not, and that they work with them and their family to then start to identify areas that they think might put them at risk, and walking beside them and coaching them
Yeah.
to sort of develop the skills to actually address those. So some of those
Right.
might be what we may feel as small. Some of them may be, I have no more ID. I've lost my ID. How do I get my ID again? And
Mm-hmm.
instead of us getting the ID for this person, it's coaching them to learn and realize they have the strength to go get their ID. And that's an easy sort of first step, but it's things also like, I actually want to get back in school, somebody may say, or somebody might say, I want to get a job so I can help my family more. And so it's developing those goals, developing, being coached to develop those skills to then be able to achieve some of those goals.
Right.
And also to say, so we talk about what does it mean to be successful? Well, hopefully people aren't coming back getting injured and coming back because they're injured. Hopefully they're reaching their goal. But what was really an amazing part of going through this co-design piece was hearing the importance of building capacity to thrive and be an ambassador and be a hero, a good hero. And that is actually one of the most important pieces here. And so that's actually where the name Thrive really came from. We want people to thrive.
Yes. Yeah. We don't want them to just survive the unthinkable injury. We want them to thrive. And I like the approach of sustainability by connecting to resources, by utilizing the assets that already exist in their own persona, their own families, their own communities, and connecting those dots so that the knowledge stays within. You know, funding in dollars is nice, but having sustainable change is even better, you know, is even better. And so what I also appreciate is it's very clear for those of you who are listening that Thrive is really both a prevention and intervention program. We're intervening bedside, but the goal really is to prevent folks from getting involved in traumatic injury. So it is actually meeting both of those components, which is really, really nice. I want to dig a little bit deeper and sort of pick up where you all started, and particularly you, Deshawn, really highlighting the importance of collaboration. Both of you are frontline workers, which situates us in the perfect zone of the season 4's theme, From the Front Lines. But both of you are frontline workers who are impacted by violent traumatic injury, and yet you come from this work with different experiences. Why is it necessary to work collaboratively, and what makes for a successful collaboration? Why is it necessary, and what makes for a successful collaboration?
I believe collaboration on projects like these is supremely necessary. What makes it necessary is just being able to, how would I word this? Like merge the information, you know? Carolyn has some information that I don't have, and I have some information that Carolyn has. We're working on the same purpose. We're
Yes.
working at that person not to repeat, not to come back through this cycle, you know? So I believe collaborating, like it helps. Sometimes you can't reach certain places, so collaboration is necessary, you know? Some people I can't speak to, Carolyn can speak to. Some people Carolyn can't speak to, I can speak to. So I collaborate, it's only for a greater purpose. There's power in numbers. So I believe collaboration is like super necessary, and then it's always for the greater good. It's all more knowledge. You know, how could you go against that?
Yeah. Well
And
said.
yeah.
Well said. Well
I
said.
don't know that I have much more to add.
Right.
Like, he's so great. But there's also, I think it's really the fact that you can't do it from you can't address these from one viewpoint.
Exactly.
And really not even just from two viewpoints. We really needed, as we came through this, is to hear from so many people. And, it was, we had mothers and we had various different people that were able to bring in ideas so we're excited to launch. Hopefully, these things take a while, but we're so excited to launch. But I also know that we're going to hear and we're going to learn and we're going to collaborate and we're just going to keep making it better. But not one of us on our own could have come up with what we came up with.
Yeah. And folks, again, Crib community, that's how you do culturally responsive research. You listen to the voices, you center the voices of those who are directly impacted, center the voices of so many who are doing the work, and then it comes together in a culmination of culturally responsive practice. So I'm super excited to be a part of it. I'm really honored to be a part of it, for sure. I want to take another deeper dive in terms of who you are. It's a question we ask all of our guests, in particular from the front lines, which is when you think about what it takes to support communities overwhelmingly impacted by firearm injury and fatality, homicide. How do their experiences impact you personally, a frontline neighborhood ambassador and a chief of emergency medicine? Where do you go for support, and what do you still need to keep going?
I don't mean to jump, but this one is this question is just so amazing. I want to answer it right away. So honestly, what supports me? I don't mean to sound cliche, but honestly, it's Carolyn and it's you guys. Like when I'm on the front baseline, and sometimes the emotions get to you. You kind of get numb to the reoccurring cycle. But then when you hear like Carolyn say like, I felt like there was a void, it lets you know that some other people are seeing it as well. So that's support. That type of support you need. It reassures you that there's a job to be done, beyond that step, So to me, support and those things, like that's my support. At least when I need support, I look to my peers that are doing it as well. And them continuing to strive through reassures me. And then also the people that I work with hands-on. When I see them become ambassadors, like I became an ambassador, it's the greatest feeling, honestly. When you see the youth, and that was a big point when we were making the program, like the youth becoming ambassadors, being able to go back and say, look what I did, or go back, look where I've been, because it's a lot of times when these people are encountering these actions, these unfortunate circumstances, they've never seen much outside of their postal code, outside of their area, When you experience more, your mind opened up more. And when you see a child or a young adult's mind been opened up like that, it's an amazing feeling. That's support.
Indeed.
So, similar to Deshawn, I think, you can't just treat them. You have to, and that's my experience, is if I do too many shifts in a row and I'm not spending time creatively thinking about public health and prevention and ways we can stop fighting fires every single day, then I start to feel myself just not enjoying my career. And it's so for me, it's important to have this sort of mix in my career of, being able to see change and make change. And when I took on this leadership position, it was in part because when you sit at the leadership table, you actually get a voice in how direction and what happens. And as I think that's really important to say for anyone. And I think it's important to say for women and people who have been typically disadvantaged and not at the leadership table. It brings an opportunity for you to be able to say that. So I will also say that, that's now I'm doing research and this advocacy work, and I'm being a leader as a chief, and I'm being a clinician, and it is tiring and it is hard. And I think it'd be false to say it isn't hard when you're working these hours. All of you have these experiences, I suspect, that are part of this program and listening in. And so it has become more and more important for me to really acknowledge the importance of self-care. And so I try to sleep every night. Not every night do I sleep, but I really try to protect that time. And I sing. And I sing in a choir with people. Right. And music and singing is a big part of something that I do and my daughter does. And I sing with my daughter. And that's important, to be with people, and just singing is an incredibly healing thing. And it has been a big part of my life. And actually I am fortunate to have a garden. And I love gardening. And these things are small. And I realize, like, the gardening now is making me feel like a little old woman. But I have being able to create and see things grow and get my hands dirty is so healing for me. And I still feel so lucky to have a garden to do that with. And so I believe very strongly in making sure my career has that sort of, but I've really had to have some time that doesn't have to take a lot of time, but is a big part of who I am. Mm-hmm.
So important. So important. Thank you. Thank you both for the work that you do, but more importantly, the way that you do it. Thank you so much. Thank you very much. So the last question, time went by so fast, we got a late start, but I think we got some good points in to share with the Crib community this evening. But what is your greatest hope for Project Thrive? What is your greatest hope for Project Thrive?
My hope is it stops being something that people see as let's try this out, or let's see if it works, or, well, where are we going to find the money to keep this program going? I want our hospital, I want our systems and healthcare to see these as just like we see a cardiology visit or a follow-up clinic after you've broken your arm. People and systems and governments see the kinds of programs that prevent and intervene and care for the people as whole and see them grow is actually something that just should be and is normal. And actually, one day we'll also do the study to show it saves them money, so maybe we can just get it on that point. But really, I feel like we just need for people to see why programs like this are essential to people's health.
Yes, to piggyback on that, my greatest hope for Project Thrive is for it to reach everybody who it needs to reach. I want it to reach everybody who it needs to really touch everybody who it needs to touch, and for it to be a proper tool for everybody it reaches, and to get into all hospitals across Canada, maybe even down in America. But I just believe, like, something like this, it's just, why not? Like she said, it should be a routine in the hospital. This should be regular. It should be like a regular visit. Like, stop by the Thrive office just before you leave, so you can thrive. Don't thrive.
Normalizing the care that's necessary for us to thrive. Yes. Thank you so much. Thank you. I I admire and appreciate both of you so very much, and I consider myself lucky for our paths to have crossed and for us to be doing this work together. So I think
I just gotta say, I'm so fortunate to have gotten to know you. And I ran into a colleague this morning on Bloor, and I was like, oh, I get to be on the Crib today with Tanya. And she's like, oh, she's on. And it was just so funny. We're big fangirls of you. This is Janelle, Joseph, and I. And it was just, we had like a full fangirl moment. And I was like, I know, I get to know her. So thank you for you and everything you teach to me as well. So
I feel the same way. I was scrolling through the page. I'm like, whoa, I'm about to be on. Thank you.
What's that, Deshawn?
Thank you for the platform for us to voice Thrive, Project Thrive.
Absolutely. Anytime. Thank you both so much for coming. Crib community, as always, thank you so much for tuning in. And from our crib to yours, stay safe and keep well. Good night.
Good night.